Hey everybody, welcome to the Home Care Forum podcast with your hosts, Sasha Guillaume and Emina Poricanin. We have a special guest today, and Emina will be doing the introduction. Emina, take it away.
Indeed, it is a special episode today because we have Mia Haney, CEO of Pennsylvania Homecare Association, here to talk to us about all home care issues, Pennsylvania and national related. Mia, thank you so much for taking the time to join us.
Thank you for having me. I appreciate it.
Could I ask real quick, just for
Yeah.
background, Mia, are you full-time with the association or are you an agency operator and that's your relationship is that you are elected president?
I'm full-time with the association. We do have a board of directors that are all elected volunteer positions, and they are all agency owners and operators here in the state of Pennsylvania. So our association gets a ton of support from the frontline workers.
Great, thank you. Sorry about that, Emina. You can take over if you would like.
So, Mia, we had the pleasure of seeing each other just a few days ago, actually, at your annual home care show, and it was a huge show. First of all, congratulations on pulling that together again. I always enjoy coming. There's such an energy there, not only from the providers and the vendors, but you actually have elected officials coming and providing input on all of these issues that are so critical to home care. So kudos on a great show. And I just got your email kind of summarizing some of the theme and the concepts that were discussed. Do you want to tell us a little bit for our listeners who did not have the pleasure of coming to the show? Hopefully they can be convinced to join next year because I'm sure it will be another great one.
Yeah, thank you so much for coming and always for participating and providing great education for our members. As I said, our members are largely owners, operators, administrators of home care, home health, and hospice agencies. And annual conference is just an opportunity for them to all get together, to network, to share best practices, but also to be engaged with their payers and to be engaged with their regulators. And so I think this year we really leaned in heavily into the regulator and the payer relationships. We had the Office of Medical Assistance Programs, we had the Office of Long-Term Living, we had the former Deputy Secretary of the Office of Long-Term Living speak. And we were really fortunate to have one of the representatives from the National Alliance for Care at Home come and give us a federal picture of what's going on in our industry. And there's a lot going on, and everybody is very aware that home is the cost-effective option. But oftentimes when it comes to funding, we are not prioritized. And so a lot of what we are talking about is how do we do more with less and less? And that has been the theme for years. And, for us here in Pennsylvania, we've hit a crisis point when it comes to workforce. The rates have not kept pace with inflation in the past 12 years. For instance, with personal assistance services, the rates went up very minimally, $1.91 in 12 years. But in that same time frame, those employers raised payer wages, I should say, almost 32%. So, we're just trying to do the best we can, maintain good quality, innovate, invest in this space, and do that all on a very, very low reimbursement rate. And Emina, I'm sure you saw it here in Pennsylvania for personal assistance services. Our rate is $20.63. That's before you pay taxes. That's before, after the wages that you pay to the workers, and then you have to pay all of your overhead and the cost of your facility and the cost of your quality compliance officer, and every single regulation, OSHA, HIPAA, you name it, that they have to comply with, all needs to be paid for with that $20. And if you look at what every contiguous state is paying for the same service, we are below them by at least $4.53, which is just unheard of, right? When you've got West Virginia paying at $5 more per hour than us, we've got a problem.
Agreed. And doing more with less is kind of a theme that those of us who predominantly operate in New York are familiar with, because we certainly have our own similar set of challenges, right? Given the cost of living here, the reimbursement is just not adequate. There have been regulatory increases to minimum wage, and the reimbursement has not kept up with that. At the same time, we have the same workforce shortage, and trying to convince, whether it's just people or anybody, really anybody to take a passion and provide services in this area, the wages certainly don't help the situation.
Yeah, we say here, folks are picking passion over paycheck, right? Like if you stay in this industry, you're doing it because you love it, because you love the person that you're caring for, because this is a calling for you. It certainly can't be about the paycheck because the reimbursement rate does not support pay that can fundamentally support these workers and their families. And many times these are single moms that are taking care of themselves and their children on these wages that are just really unacceptable, and we need to do more. And the same goes for nursing services. We have nurses that we are competing with facilities, we're competing with hospital systems when it comes to wages. And the hospitals have been talking about the nursing shortages for years, and they've been talking about how do we get more nurses into the system. Well, home care has an even harder time because now they're competing with hospital-based wages, whereas their wages are Medicaid run, and Medicaid has limited them over the years. And, these children, medically complex children and very fragile adults that they're taking care of, if they're not showing up to their shift, those folks are going to an ER or going into a hospital, which is much more costly for the Medicaid system here in Pennsylvania. So, we need to prioritize rates. We need to prioritize our ability to be competitive with this workforce, and we need to fund the front lines, which is our rally cry this year from an advocacy perspective.
I want to thank Emina for setting this up and Mia for joining, because, for people who listen to us, mostly New York-based agencies, tune in and say, hey, why do we have somebody from Pennsylvania speaking with us? But the fact that federal issues are such on the front line, we need to learn from each other, right? And this is a situation where your association is as effective as it is, and where we're lacking in New York, we can learn from. I'm assuming there are some reasons that Emina wanted to have this meeting and maybe introduce me to you and our audience to you, because these are some of the things that we're talking on the background. So I hope we can continue this conversation after this, because I'd like to learn from you and try to bring some of what you're doing to New York. So thank you.
Also, Sasha, one of the reasons I wanted Mia to come on is because increasingly over the last 5 years, I have seen a number of providers go into Pennsylvania. So despite all of these challenges, which maybe the providers are thinking, well, it's the same thing as in New York, I know how to address these issues.
In my previous life, Sasha, I actually worked for an organization that had operations in both New York, Pennsylvania, and about 5 other states. So absolutely, when you're in that position where you're overseeing multiple states, you start to see the same themes in every state, right? It's, every state's a little bit different because it's Medicaid dollars. So the states have a lot of authority on how they get those dollars out into their networks and how they oversee them. But fundamentally, we share best practices. We share really policies, procedures. And while New York is always going to be its own beast, right? New York has quite the system up there, and it is challenging for new providers to get in. It's challenging for existing providers to stay in and be successful. You'll see in Pennsylvania the same thing, right? You've got providers kind of coming to the state and saying, eventually something's going to have to give with this reimbursement rate. But, Pennsylvania doesn't have huge barriers to entry for providers who are interested in coming to the state. But once you're here, from a compliance perspective, from a regulatory perspective, the barriers are increasing substantially. And that is because we are a highly regulated industry. And this industry is going to get more and more regulated, more and more scrutinized as we go, because there's big dollars federally going to these programs. And so we need to be prepared to talk about fraud, waste, and abuse, how we prevent it as an industry, how we take part in those prevention efforts, and then also how we support one another to make sure that we've got the best quality that we could possibly provide.
Mia, you have a managed care system for home care services as well at a high level. Can you tell a little bit to our listeners how that managed care system is set up and how it works? Because I'm sure they will run comparisons as to what we have here in New York. I think you have a limited amount of MLTCs, which makes it a little bit more manageable for the providers. And I don't know that it's as cutthroat of a give and take type of relationship as it is in New York. With the MLTCs. And what I mean by that is the MLTCs are very much making the providers their marketers. We will give you a contract and work with you, and we will fix your rate depending on how many referrals of patients you send us per month.
Yep, that's a New York thing. No, Pennsylvania is just different. So we do have managed care for long-term services and supports here in Pennsylvania. Currently, we have three managed care organizations. They're all state providers or plans, I should say. And those are AmeriHealth Caritas and Pennsylvania Health and Wellness, which is a Centene company, University of Pittsburgh Medical Center. So the three of them are actually, they work closely together. They have regular meetings. They align on many policies, not all, but they align on many. And really, while each one of them absolutely would love to grow their membership, I think we are all in Pennsylvania very focused on quality initiatives, on innovation, on value-based purchasing, on how we can make sure that we are driving positive patient outcomes. So not unlike your MLTCs, we're all looking at how we make sure that we are running the most cost-effective program. Managed care organizations are as interested in that as our home care providers are.
Would you say that your value-based program or initiatives have been fully rolled out in Pennsylvania? In New York, I don't feel that we are there yet. There's maybe one plan that is, I don't even want to say they're fully. They used to be more active on the value-based side, but I'd like to see if you are, and how it's working out, and have you seen actual value in that?
Yeah, so I would say that there's always more opportunity to do more value-based contracting, but we have had plans roll out their own versions of value-based contracts that providers can choose to take part in. It keeps it consistent, so you don't have a different contract and a different program with multiple different providers, although we do still see that with certain providers. But we've seen care gap closure programs. We've seen quality metrics programs, such as like EVB percentages being above and beyond and garnering maybe a higher reimbursement rate. And we've seen some start and some stop as well. So I would say that we're engaging, and certain providers, especially providers of scale, have the ability to kind of do pilot programs and work with the MCOs and show value. And I think it's just identifying what measures, what HEDIS scores, what is it that's important to that managed care organization that we could be taking part in. And that is really hard to do when you're a small provider and you're just trying to open the door and have the first conversation without already having a pilot program or a whole team working on doing this already. So while I always appreciate when the MCOs come and tell us and ask us to innovate, I'm also like, oh, innovating is really a big investment. And when you don't have the right reimbursement rates, you're eventually going to hit an innovation wall where people can't innovate beyond a certain level because they don't have the reimbursement to support it.
One question that may be very, very subjective, but when I attend your conferences, I'm always amazed at how many smaller agencies there are. And in comparison, a lot more family run, I feel like, smaller mom and pop, very, very patient-centered organizations. What would you say is the average size of an agency in Pennsylvania? And I know it's a huge state too. So that's why it's a perspective question.
So I think the last time that I looked across Pennsylvania, we had about 5,000 home care, home health, and hospice providers altogether, which is a lot. So that indicates that we have quite a bit of smaller, as you said, mom and pop organizations out there. Home care in general is fragmented in any state that you go into. You're always going to have a number of providers. There's going to be big, there's going to be small. We do have a handful of very large organizations that are supporting a huge percentage of this Medicaid population. But the reality is that the Medicaid population is only a small percentage of the whole senior and aging population. I just saw a report the other day that this Medicaid, population that's served is really only 13% of the whole here in Pennsylvania. Well, that means that private pay is a large portion of how these folks are receiving services. And if you think about children as well, you've got a ton of children on the program too. So when it comes to size of agencies, I think we've got a good representation of the big, the average, and the small here in Pennsylvania. But there's always a place for a small mom and pop who does excellent work. And I think that that's because this is such a personal service, right? You're inviting someone into your home. They don't know you. You don't know them. And it makes you feel a lot better when it's the local agency around the corner than if it's some large agency that's coming from a different state.
The other thing that was striking to me was that perhaps it's because of what has been happening in New York, but on the labor and wage and hour side in New York State over the last decade, there have been so many class actions and so much emphasis on payment and proper payment of wages to New York home health aides. I go to Pennsylvania and people are openly saying, I'm not paying overtime. I don't want to pay overtime because I am not getting reimbursed. And it seems to be more widespread than in New York, where I think either, well, it's possible people are not fessing up to it as much in New York. Or it might be that people have gotten their hands slapped so much in New York, they've learned their lesson, whereas in Pennsylvania, it's not as litigated or as audited. But it struck me all these years I've been coming to the conferences, how many providers will come up to me after these presentations and say, I don't pay overtime, and I don't know anybody who does because we're not getting reimbursed for overtime. So, I'm not going to put you on the spot, but I just thought that that was striking, how that sentiment seems to be a bit different about overtime because the providers truly have been under attack. I think in many cases unfairly by worker groups, by the Department of Labor, U.S. and New York, and then class action. Plaintiff firms have just been horribly aggressive, chasing these providers down as modern day ambulance chasers. It's great that Pennsylvania they don't have that in the last 10 years.
Yeah, so actually that's not been my experience. Fortunately, no organization has come up to me and told me that they're not paying overtime, because if they did, I would start panicking immediately for them, and I would be absolutely getting them to the resources that they needed to be able to start implementing that and to make sure that they're adhering to all the laws and the rights of these workers, because these workers deserve that. We have seen an increase in Pennsylvania in the number of class actions. We've seen an increase in the number of just Department of Labor audits. Sometimes it's the focus is always a little bit different. One year there was a huge focus on live-in and how you're reimbursing that live-in worker. There was a year that the huge focus was on travel time. And then the next year it was on break time in between travel time when there's time that's left over between two appointments. And so we've seen those shifts and I think we've navigated them. I think that when you have so many small mom and pop agencies, it's hard for even a Department of Labor or another entity to be able to jump in there and hit every single one of them. So I think that is a challenge, and it's just about education. And that's why we encourage folks to be part of the Pennsylvania Homecare Association, because we educate, and we'll educate about just how much risk they're carrying if they're not paying appropriately, if they're not adhering to those laws. So that's a huge concern of ours, that we make sure that we're elevating this industry, that this industry isn't seen as a group of individuals who aren't following laws or regulations or who are providing waste in the program. We want to be quality providers that are pushing the program to be better and raising the bar.
Can I ask you about a thing that's fascinating to me about your conference was the involvement of the politicians. So on our last episode, we discussed Governor Hochul seeking the power to cut up to $200 million of the budget after the fact due to the looming federal cuts, right? To me, that makes sense because with the country's facing $800 billion in cuts at the federal level, and which will definitely impact the American people. You have 7 million which are elderly who are enrolled in Medicaid, 5 million which are disabled. So one, we're seeing the protests at the federal level. I'm not seeing the associations as involved, at least currently in Albany. But the fact that you're getting your politicians to come in and you can speak to them directly, have they mentioned, at least at the state level, what they're planning, anticipating the cuts? And I don't know if there's anything that can be done at the federal level, because it looks like that ship has sailed.
Yeah. Well, federal level, it's changing every day. So anybody who tells you they know what's going to happen there, they must be very, very close to the key decision makers, because from what I could tell, it's anybody's game every single day as we move into next steps. So federally, there's certainly uncertainty, right? So we don't know what's going to happen there. We are watching it very closely because there's implications to all of it. Anytime that you've got a large number of folks who are transitioning out of Medicaid due to eligibility or due to different initiatives, we've got repercussions to how those folks get health insurance, right? Are they now going to get employer health insurance through their home care agency, where before they might have been relying on Medicaid? If they have to prove work hours, how are they proving those work hours? Are they getting enough from the agencies that they work for today? So we'll be looking into all of that. What do provider taxes look like? How does that change in our state, in New York State and other states, and just monitoring it. But when it comes to our state budget, I think our legislators are doing the same thing. How do we make a decision on what to do with our state dollars when our federal dollars are so uncertain? And there's, we don't have a great budget environment here in Pennsylvania. We're trying to make up for a very significant deficit, a rainy day fund that isn't as reliable as we originally hoped for. And so what I would say is that our legislators are largely looking to the federal government and saying, what are they going to do so that we can make some sound decisioning here in Pennsylvania, which I appreciate. You want to get as much information as you can federally before you make your state decisions, but we got to get a budget passed. And it's looking like this year, our budget may be a little bit delayed from the July timeframe that we typically see.
Do you have an MLTC tax? I'm just curious, in Pennsylvania, that's been a topic of a lot of discussion in New York. I know that there's a federal tax on MLTCs that has been proposed, and in New York, it's just been fraught with all sorts of opposition. So I'm just curious how Pennsylvania handles that, and if it is being handled.
Can I jump in there and add to, because the proposal of CMS is the MCO tax loophole to be closed, right? Which allowed New Yorkers to have a workaround and increase federal funding without contributing, right? Which is, to me, that this paper solution to the problem is weird, right? Like that's a bad solution because it leaves you susceptible, right? So if CMS is arguing that it violates the intent of the law, which requires states to share in the Medicaid costs, right? And so the proposed rule would prohibit states from taxing Medicaid plans at a higher rates than commercial ones. Win for the plans. It eliminates the vague or disguised tax structure that disproportionately impacts Medicaid. Again, a win for the plans, from my perspective, and it would end the most aggressive practices and phase out all those over years, which hurts Medicaid generally. So, this is going to look at, like, we're looking at a 10 billion plus shortfall in the 2025 budget as a result. Again, why Hochul would want the power to retroactively cut. So, your thought?
So I haven't been following as closely with New York, obviously, as I do in Pennsylvania, but we do have provider taxes here, and we don't rely on them as significantly as some other states do, but we do have them specifically for hospitals, MCOs, nursing homes. Home care does not. What I would say is that the grandfathering that we're seeing is a relatively good outcome, but our budget office is following it and monitoring it very closely. We're looking to renew those provider taxes for sure, because they are important to our budget process.
And I'm out of questions, and I feel like I've been grilling you, so I definitely want to stop with the questions. Is there anything kind of, if you had the open mic, Mia, that you would want to say? The floor is yours. I could set it up.
Thank you for the floor. I would say that I am just so humbled when I meet our providers, because what they do is so mission driven, and the work that they do is so critical to how our communities live and thrive. And at the end of the day, if we forget that, then we have lost our purpose, right? There are patients, there are children, there are adults, there are seniors that are getting this care, that have better lives, that are living more independently, that are not going into nursing homes or facilities, and they're staying where they want to be because of everything that this provider community does. And they should be just really proud, because I am, to be part of this industry. We have our challenges, right? Medicaid is challenging right now. It's a challenging budget environment no matter what state you're in. Everyone needs the funds, and we want to see them stay in place. We certainly don't want to see them cut. What my hope is in Pennsylvania is that we don't take this federal uncertainty and freeze because of it. We have certainty in Pennsylvania over the issues that face us today, which is that our reimbursement rate is 23% below where it should should be, according to a rate study that Pennsylvania did. So that means that we know we've got a problem. What I would hate to see happen is that we don't address the problem right in front of us because we're afraid of the possible problems that are going to come from the federal decisions. We've got to do both. There's got to be a way that we find the path to being able to fund these services the right way and to fund the front line the right way. When I say fund the front line, I mean those direct care workers and those nurses who deserve to be recognized for all that they do. So I would just say thank you to both of you for having me on your podcast today. And if anyone has any questions, feel free to follow up.
Mia, you couldn't have said that better. And just before we close out, I do want to say that I was very touched when you were mentioning and I think you played or read the statement of the caregiver who was taking care of your grandfather. That was very touching. The genuine feelings of pride and gratitude from that caregiver for being part of your family and having that role in your family to take care of your grandfather. That was very moving. And I thought it was wonderful. And it expresses your sentiments exactly. These people have one of the hardest jobs there is, and they absolutely deserve more. I hope that they will be prioritized, right? There's a big pot of money that our elected officials every year decide how it gets spent. And it's time that these workers are prioritized in those discussions. That's what it boils down to. So, thank you so much for being on the podcast. Like I said, I have a lot of clients who are constantly going into Pennsylvania. They love that environment. And thank you for being part of the movement that has made it so welcoming and good for them.
Well, thank you so much. And everything that you do for our providers to support them is so very much appreciated, Emina. And I'm so glad you enjoyed conference. We're looking forward to having it again next May 4th to the 6th in Hershey, Pennsylvania.
Thanks for
Bye, Mia.
joining.
Thanks so much.
All right, that was great. Thanks again to Mia for joining us. I just want to close out on some New York specific items. I did mention Proposal 1 from the federal. Another proposal is the congressional plan that would slash New York federal matching the FMAP, where New York receives about 50% of money from the federal government. It covers half of Medicaid costs. Under the congressional proposal, New York's FMAP would drop to 37.7%, and New York would have to make up the $116.2 billion in federal matching funds between 2026 and 2035. Again, I mentioned earlier, so that it's about a $10 billion cut plus for the coming fiscal year, for the coming budget. NHTD waiver cap, the legislature has rejected the governor's proposal to cap the nursing home transition diversion program. However, the state's budget included reductions in Medicaid spending for the program. The budget also maintains level funding of $1.8 million for housing subsidies under the NHTD waiver. Reduced funding, however, will result in fewer resources and therefore a reduction in services, so a de facto cap. This is why advocating for maintaining status quo is not the right way to advocate, in my opinion. Politicians act to reduce spending or bring funds into the state from the federal government or through taxes. So continuing to fight against math is a losing battle. We need a constant presence in Albany and to work with the government proactively instead of constantly reacting so that we can protect the industry. So we need to partner and be a resource to the legislators in their coming with solutions. That said, there are plans for us to take action in that. And Emina, I'll speak to you offline after this. But there are plans coming, and we hope to bring that information to you shortly.
On the next podcast, we will have Acting Director Frank Walsh from the OMIG speaking with us, as well as Bill Schwartz, about some of the OMIG initiatives, as well as the areas that they're looking at, including PPL-related updates from OMIG standpoint. So make sure you tune in for that. Thanks for tuning in today. Hope the information from Pennsylvania was helpful to those of you who may be considering going there or who are already there operating. And until the next time, thanks for tuning in to the Home Care Forum podcast.
Thanks, everybody, for listening. This has been the Home Care Forum podcast with your hosts, Sasha Guillaume and Emina Poricanin. Have a good one.